Welcome to the Breast Cancer Resource Center's Ask the Experts, Let's Talk About Breast Cancer series. Today, our topic is how to have a good death, understanding death doula services and hospice support at the end of life. Hello, my name is Elaine Gonzalez, community educator. We are so honored to have here with us today, Reverend Nancy Chester McCranie, the Director of Volunteer and Bereavement Services with Hospice Austin, and Angela Baucom, an INELDA-trained death doula. Thank you, Reverend McCranie, for being with us today.
It's good to be with you. I'm Nancy McCranie. I've been with Hospice Austin for 22 years. I started as a chaplain and then was director of spiritual care for a little while, and then for the last 14 years have been director of volunteer and bereavement services. I really appreciate the opportunity to get to talk to you about hospice care. I just want to talk to you a little bit about what hospice care is. A lot of you may know someone that has benefited from hospice care. It's a really amazing benefit that Medicare supports, and a lot of people don't realize what a true benefit it is. And so many people that we serve wait until they have 2 weeks left or less. And it's really built for a lot longer than that. And there's so much more that people could take advantage of. So one of the things is that I want you to know is hospice care is available to anyone, regardless of the complexity of their care or their ability to pay. So, a lot of people, they've used up all their insurance benefits dealing with a chronic illness. And that is not a barrier to receiving care through Hospice Austin. Not all hospices are able to provide care to anyone, even people that have run out of financial resources. But that's one of our goals. That's part of our mission, is to serve anyone who needs us. So who do we serve? Really anyone with a life-limiting illness with a prognosis of 6 months or less, who is ready, along with sort of the advice of their physicians, to elect a course of palliative care. So palliative care basically means comfort care. And hospice can't conflict with other benefits like dialysis. If certain people are receiving radiation or chemotherapy that is palliative, that is, it is relieving symptoms, or it is relieving pain, for example, as one of the symptoms, then you can still qualify for hospice care. If you're not quite there, I want to say we have a palliative care program, Austin Palliative Care, that's under the same umbrella with Hospice Austin. And I'm a huge fan of our palliative care program, because a lot of times people need a little more help. They need some more eyes and ears, and people looking with them down the road. They need somebody to call after hours if something comes up, and it always seems like something comes up after hours, right? And our palliative care team is there to provide that. It's not as comprehensive as our hospice care benefit, but there is a nurse practitioner and a physician. There's somebody that answers the phones 24/7. And so that can be a nice thing to do when you have, say, 2 years. You're going to be living with this for quite a while, and getting on palliative care is always a good thing to do. I got my mother on palliative care. She has Alzheimer's, and they were able to help me when it was time to make the transition to hospice care. You would think I've worked here for 22 years. I would have known how to do that, but it was so close. I couldn't see that she had changed enough that it was time to get in more care. So I just wanted to throw in that about Austin Palliative Care. So I'd like to ask, is hospice a place? A lot of people think it is. And I would bet many of you are shaking your heads no. Hospice is a philosophy of care that says dying well and with dignity and respect is a very real option that you can craft to a large extent, not completely. You can craft how you want your death to look and feel. We can't know when that's going to happen, but we can keep people home for example, if that's a goal for them, we can have things in place that make people feel comfortable and loved and safe. So hospice is wherever people are. So that is at home, in nursing facilities, in hospitals. And then we have an inpatient facility called Christopher House. That's amazing. So what services are covered by hospice? Of course, you get a team, and we all work as a team. We are just really big on, there are no Lone Rangers here at Hospice Austin. So your hospice team would be a physician, a hospice certified physician, RN case manager, a social worker, a chaplain, a home health aide if you need that. The only person on your team you have to see is your nurse, but all the other services are assigned and provided to you, but you don't have to, have people in and out of your home if that's not comfortable for you. We also have volunteers available to help run errands, to help provide, some friendly visits and some support or some respite for a caregiver. Hospice also provides different levels of care. So, things may be going along really great, and then there may suddenly be a crisis. So we are able to come in and provide what's called crisis care and have staff that are dedicated to you until that crisis has passed, whether that's during the day or in the middle of the night or on the weekend. And then, as I mentioned, we have Christopher House. Christopher House, if you're not familiar with it, it's a 14-bed inpatient facility. It's kind of like a little intensive care unit. So for people that we're taking care of at home, if their symptoms get out of control, let's say their pain spikes and it's really uncomfortable for more than a couple hours, we'll start talking about, can we get you into Christopher House? Sometimes that can be managed well at home, or sometimes nausea and vomiting gets out of control. Or some people have had, it's called intractable hiccups, where they can't stop hiccuping. I know that sounds kind of crazy, but it's like, if you can't stop hiccuping, you can't sleep. It's hard to eat. It's hard to just be comfortable. So Christopher House is amazing. We have staff there 24/7. We have musicians that come in. We have pets that come and visit. It's just a really beautiful place. And we're really proud to be able to offer that kind of intensive level of care, but in a setting that feels very home-like and warm. We also provide any medication that's connected to your, your diagnosis, your terminal diagnosis. We pay for that. That goes through us. Also, any durable medical equipment. So, for example, my mother is in a nursing facility, but the beds were really tiny. So we got her a hospital bed that lifts up and lays down. It's a little bigger. The bedside commode, the side table, oxygen, all kinds of things. We provide it and deliver it, and then pick it up when it's no longer needed. And then people can still see their own private attending physician. They can still see their own specialists. So we don't cut them out just because we've come in. We really try to focus on what each patient and each family needs and what will help them feel the safest and most comfortable at this time in their life. That's our goal. So we don't want it to feel like a medical experience. We want it to be sort of this last time in people's life. And we want to stay out of the way. We want the person we're taking care of to be front and center at all times. I hope that makes sense. I put this in. This is more for you to look at once you get the slides, but a lot of times people want to weigh like home health or hospice because Medicare won't let you have both. Really, hospice is so much more comprehensive. We don't provide sitters. So if that's a need, that's something that families have to do privately, which I know is really expensive. But we do provide people coming out frequently throughout the week, and we can certainly help refer to like a home health or a sort of a sitter kind of situation. So you can look at this later. I want to allow plenty of time for Angela and for any questions. So how do you access hospice care? Anybody right now could call our main number and ask to speak to someone at admissions, and then someone will come evaluate and give you information that does not obligate you in any way. We are a very low pressure kind of organization. We're not really into it to try to sell you anything. We're just here to serve. And so anybody can request an evaluation, even a family member. If we've decided that you do qualify, and we have all these Medicare guidelines for every single terminal illness, we have to go by those guidelines. Then we need to have your physician certify that you're eligible. If they believe that if your disease follows, a normal course, that you could, your life could end in 6 months. If you're not eligible, then we won't admit you. And if we do admit you and you get better, then we'll be checking that all along and we'll discharge you. It's funny, one of the biggest complaints we get is people wish they'd called us sooner. That comes back almost always on our after death survey that we send to families. They're like, oh my goodness, if I had only known, we would have called you so much sooner. And then a lot of times people are actually unhappy when we have to discharge them. And that seems kind of counterintuitive. But it's the truth, because the care is so comprehensive, so loving, and it's just great. Hospices, we provide this holistic team approach, as I've already mentioned, with really a focus on quality of life and what your goals are. If one of your goals is to make one last trip to New York City and go to a Broadway show, then we will work to make sure you and your caregivers can manage your symptoms and try to get you to the point where you can make that trip. We want that to happen for you, and we'll work for that really hard. So that's just one example. Or let's say somebody says, I want to be here for my daughter's graduation in May. We're not miracle workers, but we will do everything we can to try to make that happen and to make sure you're there, even if it's virtually. So we really pride ourselves in taking really good care of people and into listening to what you need and what you want. So who pays? Medicare is a primary payer, also Medicaid, private and employer-sponsored insurance. We raise money all the time, all year long. Usually our, like we call it charity care or unfunded care, is about $2 million a year. So we don't want to turn anybody away because they've either run out of resources or they've never had resources. So we're constantly raising money so that we can take care of everybody. And then some people are able to pay themselves. And of course, that's fine as well. So when you're choosing a hospice, it's really important to know what to ask, because there are actually about 40 hospices in Austin. We're the only nonprofit. We've been here a long, long time. We've made all the mistakes that some of the newer hospices have yet to make. I think we attract some of the most amazing people I've ever met. So you want to ask, how many of your staff are certified in hospice and palliative medicine? That's a good indicator. Not all of our staff is, but a large number are. And so that's really important. It means they've taken the time to really get the expertise and the credentials in this particular kind of medical care. And then after our staffing, I want to know if the person I'm calling at 2 a.m. is fresh and awake, or if I'm waking up my case manager who worked all day long and is now going to have to drag herself out of bed to come and see me. So you want a dedicated after-hours staff. And then visit frequency. How often are you going to come see me? Is it like once every 2 weeks and that's it? Or is it, nurses usually visit once or twice a week. And then home health aides, it can be up to 5 times a week. For my mom, it's twice a week. So it depends on what's needed. And then volunteer services. So anybody that wants to volunteer, we really work hard to try to find somebody that can participate in that way. We also have pharmaceuticals that are delivered. So you want to ask about that. Do you still have to go pick up your own pharmaceuticals, which uses up valuable time and energy? Or will that be brought to you? And then the levels of care that I mentioned. So we can take care of you at home. We have an inpatient facility, or if there's a crisis, we can manage that as well. You want to ask if they're accredited. And then aftercare, what happens to my family after I'm gone? Are you all going to follow up with them? All hospices are required to do that, but what that looks like varies wildly. So we offer individual counseling free, 8 sessions for free to anyone in your circle of care. We have loss-specific support groups, drop-in support groups, a webinar that we do every month. We have a camp for children in the summer called Camp Braveheart. So these are the kinds of things you want to check on, because not all hospices are created equal. And then ask your friends, you know, who have, I mean, not obviously not the ones who have gone on, you can't ask them, but the people that have received hospice care, the family members, you can ask them what they think. I saw there were a lot of questions. I don't know if any were directed for me. Okay, so if a patient is on dialysis to prolong life, then that would not be in sync with what Medicare believes it qualifies you for hospice. So you would have to let go of that benefit. So anything that would intentionally prolong life. So our goal is not to hasten death, but also not to prolong life. So we're in the business of just keeping people comfortable. Now, I don't know enough about dialysis personally. If there is like palliative dialysis, I don't know that answer. Sitters, I don't know of any hospice that provides a sitter service. So a lot of people have the idea that when hospice comes in, they're going to be there like 24/7, and that is not true. What we try to do is offer a lot of education, a lot of support. So we're available by phone, by text, if anything comes up, but we try to really provide enough education and support for the caregiver that they can manage when we're not there. And then home health care is not really included in the hospice benefit. It's kind of either or. That's why I put that slide there. So I would say, you know, think about what your situation is. If home health is really what you need right now, then go with that. But when you look at, you know, the 2 columns I put, if what you need is really on the hospice side of the column, then that's what you would want to go with. I think I answered all the questions. There may have been a couple more.
There's one more in the chat. What if someone is undocumented? Do they qualify?
Yes, absolutely. So we mean anyone, and we've taken care of many, many undocumented people. And what I'm so proud of is we offer the same quality care no matter who you are. If you live under a bridge, we're going to offer you the same quality of care as if you live in the fanciest house in Terrytown or Westlake Hills. So we just think you are beautiful and wonderful because you're you, and we don't have any sort of distinction because of what's going on with you socioeconomically, or, you know, because you don't have your documents. Does that answer the question? Yeah.
Yes, there is one more in the Q&A.
Let's see. I don't see it. Can you tell me?
Yes, it says you said you could still interact with your physician. I thought you could not still see your oncologist.
Well, some oncologists will say to us, you got it, I'm out. Like, so it kind of depends on your oncologist. But some really want to know how you're doing. And you can absolutely interact with anybody you want to. Now, they probably won't they won't be saying, hey, let's try this line of treatment or that line of treatment, but you can still stay in touch with them. By attending physician, I sort of meant like primary care physician. And some of them absolutely still want to be involved with your care, knowing that they're working alongside with the hospice physician. So it has to all be according to Medicare guidelines. We can't break those rules. But yeah, some of those relationships are longstanding and deep and meaningful. And we want people to be in touch with whoever they need to be in touch with. Does that make sense? Like, I might not still be getting chemotherapy, but I might check in with my physician at Texas Oncology, just to let them know how I'm doing. And they might want to check in with me, or they might want our physicians to check in with them and let them know how you're doing. Let's see, do we offer resources for legal assistance such as wills? That's really what our social workers spend a lot of time on. So they're there to help with resource management, to help people get all their paperwork in place, give them comparative information about different funeral homes, cremation options. So yeah, our social workers work really hard to try to get people ready and get everything in place so they don't have to worry about that. They can just be with the people that they love, doing the things that they're able to do.
Thank you, Reverend McCranie. So we are going to move on, and then please keep the questions coming. We will answer those at the end of Angela's presentation.
Thank you so much. Thank you for having me here. My name is Angela Baucom, pronouns she and her. And thank you, Nancy, for having me follow up that really informative presentation. I'm going to do my best to try and provide you similar information about death doulas, who we are, what we do, all of that wonderful stuff. So I want to start first with what is a death doula. First and foremost, I am a death doula, so I can speak to who I am. That's not necessarily going to be who everyone is as a death doula. So just a little background about how I came to be in this role. So about 18 years ago, my mother passed away from breast cancer. And about 2 or 3 years ago, because it's the beginning of 2023, my math is all funny. It's about 3 years ago, my grandmother, in her late 80s and having lived a very, very full life, also passed away from breast cancer. Both of these women had very different experiences. Both of these women had a big influence on who I am and how I live my life. And I was very grateful to have hospice, not Hospice Austin, because we were in North Carolina at the time, but have hospice present for both of those deaths. And they played a big role in what I realized a good death could be and could mean. And that is how I approach this work, informed by my own family's experience, the good, the bad, the, good for some people and bad for others. And coming from the lens of someone who was young and now someone who is an adult. And the differences in those experiences has really helped me to grow into this position. Mostly it made me want to be able to walk alongside others as they took similar journeys. So that is my starting point. Now, as someone who has an advanced degree in social work, even more so, I've dedicated myself to professionally working in systems that help people in whatever way I can. And as a volunteer with Hospice Austin, I have been able to engage with people along their dying and bereavement journeys, and it has been hugely rewarding. And remember, rewarding is not necessarily the same as joyful, but there is a special kind of appreciation in being able to help people with carrying forward their wishes at an important time in their life. So throughout my presentation, what I'll cover is, first, what is a death doula in general? What services do we provide? And how do you find a death doula if you are interested in pursuing more information or pursuing a relationship with a death doula? And then I have a slide just giving you some other resources. So first and foremost, what is a death doula in general? We can be called a number of things. You may have heard end-of-life doula, death coach, death companion. Any format of these words is appropriate. It depends on how an individual service provider wants to identify themselves. However, across the board, we have a few things in common. First and foremost, doula is a word that you may have heard in reference to birth doulas. And that is because doula is an ancient Greek word meaning a person helping another person through a transition. You may hear it as a woman helping other people. You may hear it as something very specific to certain life transitions, but it has now become more broadly acceptable to use it for any of these people who dedicate their lives to helping with transitions. So we are, at our core, a non-medical support professional. We are, in the formal sense of the words, trained to provide kind of holistic or wraparound care in a lot of ways and support for a person as well as their family. And every time I use the word family, I am not necessarily referring exclusively to blood relations. I am referring to the people who choose to be around you and supportive of you, and who you choose to be around and be supportive of. So family can be found family, chosen family. Family can be people who came into your life at a time when you needed them and took up a big role. So whoever your loved ones are around you, that is your family. And if you are around someone in a position of love, you are also their family. So focusing on the end of life transition, we are looking holistically from the time someone starts preparing to a period after the death. So it's not coming in day of, unless that is what a person has called us for. It certainly can be, but usually we are called in long before. So we provide, first and foremost, planning and preparation services. So planning and preparation is a little bit of everything depending on the skill set of the doula. So something I want to drive home is that I mentioned training, and certainly many people who choose to pursue this are certified in some way. We'll talk a little bit more about that later. But different doulas will train in different things more deeply or more specifically. And so planning and preparation for one person may include life review, so walking someone through the stages of their life and coming to a place of openness in talking about what their next steps are. So it can be kind of an emotional and spiritual preparation, or it can mean getting documents in order. One of the things that many of the death doulas that I am in contact with emphasize is making sure that you know what documents you need. You have them completed accurately, and you have them accessible not only to yourself, but to the other folks who are going to be around you helping to carry out your wishes. For some folks, there is not necessarily a big community or family around them to help them. In that case, the doula can be more of an active support in the dying process and can be one of those people, can be the person who is watching out for that person's wishes. So they can help to make sure that whatever is in those documents is respected as that person is going through their dying process. So that's one part of support in the dying process. Another part can be something called vigil management. So we often think about post-death. We think about the formality of the funeral services. We think about how someone wants to be remembered. But one of the most important parts of this transition is the actual experience of the dying process. Hospice can do a beautiful job of coming in and providing a lot of those physical comforts. It's not always possible for a hospice nurse to sit by the bedside for days straight and manage that entire process themselves. So what a doula can do is help to map out what the time leading up to an imminent death looks like. And when someone is in the active dying process, which can take minutes to hours to days, they can help to make sure that the space is taken care of. So who is present? How do those people enter the space where a person is in the active stages of dying? What does the room smell like and sound like? Are there people who are playing in the room, laughing in the room, or is it a quiet, reverent space? All of these things are okay. It is not up to a doula to design that for a person. It is up to a doula to ask questions to identify what are the priorities of an individual and how can we assist them in having the experience they want. It's also a process of building the last gifts that we'll ever give our loved ones. The last gift that you can give someone is helping them to feel like the dying process has been one that was intentional and planned, and possibly leaving behind a legacy project of some sort, something concrete that they can have and keep. So the doula helps to guide that process during that hard time, and then can provide support following the death. That can mean assisting with home funeral planning. Sometimes they can be celebrants. They, depending on the person's preferences, can assist in coordinating transportation, can assist in coordinating contact with family members and friends after the fact. It is entirely dependent upon the needs of the family. There are doulas who come in when someone is not ill and they just talk to someone about mortality. That's all they do. And that can be a few meetings over coffee, and then they don't have a future relationship with that person. A doula can also come in the day before someone passes and can help the family rally, can help create that space, and can then see that family several months afterwards to provide them with support. A doula can come in after a death has occurred and answer questions for the family, provide that additional support. It just depends on their individual skills. So again, a little bit more detail about each one of these things. I have these slides for you to review later. You can think of them as kind of a menu of services. So you don't have to go through these in order, but you can take them step by step if you'd like to, or you can pick and choose and maybe just go for the one thing that you don't have access to under other circumstances. Hospice also provides a lot of complementary services. So if you have access to a social worker through hospice, then you might not need the document preparation assistance, or you might not need that quality of life management piece because that may be taken care of by those other relationships. So it just depends. I think one of the most important things that a doula can do is help you discover the questions that you don't know you have. So sometimes people just assume, okay, I have to be embalmed. Isn't that the law? Absolutely not. It is never required for anyone to be embalmed if they don't want to be. You also don't have to be cremated. You can be placed in a beautiful shroud, and you can be placed under a beautiful tree, and that can be an option as well. It does take a little bit of work to plan that process out, but until you hear your options, you don't always know exactly what's right for you. So again, I want to emphasize this is a menu. You pick and choose. And I want to put a special emphasis on the family respite and support that can happen in the dying process. So with hospice, obviously in-home medical care is not necessarily covered. So with a doula, although a doula is a non-medical support provider, they can on occasion provide respite. So if you need someone to just sit with someone you love while you go to the store, while someone takes someone to soccer practice, it's nice to have that peace of mind that someone you have a relationship with and who's familiar and can have the conversations and provide the support that's needed can be present. So personally, one of the things that I've become very, very aware of in the bereavement process after a death has occurred is that oftentimes support withdrawals from the community. So you may experience a period of several weeks after a death where people are very actively reaching out, where people are very involved. And then usually people who have not experienced a close loss themselves, they'll just kind of expect people to get over it. And I know that sounds cold, but it is a common sentiment. Oh, well, it's been 3 weeks, it's been a month, it's been 2 years. Why aren't you over it? Why can't you move on? So a doula can come in several months down the road. Usually I prefer to check in about 6 weeks after a death has occurred, and then a few months down the road, depending on the preference of the individuals being contacted. All we do is touch base, create open and caring spaces where people can process. So immediately following a death, that may be just processing the immediate experiences, the difficulties of being in a room with someone you love who is very ill. It can be a lot to deal with. So just giving people a space. It's not therapy, it is space. I know we've all had an experience probably where someone we care about has not reacted well when we've had difficult emotions. You know, maybe they kind of shy away. Maybe we realize they're avoiding us. Hopefully you haven't had that experience, but I know from my experience with people experiencing grief, it's very common. So the doula can be there to talk through some of those things and possibly to identify the need for additional resources. If someone is really struggling in their healing process, we can give a referral. We can say, hey, maybe you can check out Hospice Austin and see if they have some bereavement support services that you can access for free, or if someone has a relationship with a therapeutic caregiver. Help people to get motivated to take those steps. So if you are looking at accessing doula services, there are lots of places to find a doula. Similar to how Nancy said, no two hospices are really created alike, and you probably want to go in with an idea of what you want or what your priorities and needs are, and then interview different ones. Same thing goes for a doula. If you want to do online doula services, you want to just talk to someone and do, you know, a Zoom session to help you plan, to help talk, that is completely acceptable for some folks and not for other folks. So finding a doula that is in the right area, provides the right access, can be really helpful. If a certain type of spiritual care is very, very important to you, for example, if you really need a doula who is familiar with Jewish burial traditions, you do want to reach out and find a doula who is experienced with that or has access to the resources that you need. So when you are looking at doulas, there's lots of directories for people who have been trained by formal programs. You can also reach out to your community and see if anyone has experience with this sort of thing. I know it's relatively new. It's less than 20 years old as a field, but there have been people walking alongside others through their dying process for decades, and eons. As long as people have had spiritual connection and practice, as long as they've had community, there have been people with these types of skills who walk alongside others. So I would encourage you to reach out and find out what different organizations have available. So I trained with INELDA, the International End-of-Life Doula Association. There is also NEDA, the National End-of-Life Doula Association. They both have very robust directories. But there's also a few here. Some of the best known ones are listed below. And I want to put a special little pin in quality of care because that is a local training resource by a wonderful teacher named Deanna Cochran. So any of these are a good resource. A little Google goes a long way. And when in doubt, you can reach out to me or another doula in your area and just ask questions. I don't know a single one of us who would deny someone a few free questions regardless. So I have a few links to other resources, but all of these things are just for your education and exploration. So I won't belabor this slide, just know that it is there for you, depending on what you're looking for. And I will kind of wrap up with a few commonly asked questions, and any additional questions, of course, continue to ask them in the Q&A in the chat, and I will very happily answer them as I am able. So I mentioned the training programs a moment ago, and I mentioned that there are people who are just community members who do this kind of practice. So end-of-life doulas, it's important to note, are not licensed professionals. A license is very different from a certification. So a certification is when you go through an educational program, you complete that program, and there's some required elements. So when you look at, for example, INELDA's website, there's central pillars of practice that you know when you go through that organization, all of their trained doulas will have access to that information. So for example, I am trained in guided imagery, I am trained in end-of-life paperwork, I am trained in legacy projects, which are projects that you create to leave for your family to help them keep you in a special place. Anything from a dance performance to a little repainted cigar box with some special keepsakes inside of it. Lots of different ways to go about that. The doulas can actually help with. So because we're not licensed, meaning certified by a governmental entity, we can't bill through insurance. When you want to access doula services, each doula has their own price points. It may be based on other licenses or certifications that they have. So for example, I know that some doulas are actually registered nurses. So they may provide things that I cannot provide because I don't have a medical background. It is something to consider alongside what the needs are in the moment as to whether or not that is something to pursue. I know a doula who is a massage therapist. I know doulas who are certified yoga instructors. There are lots of different ways, different angles, but doula services are not a recognized billable service under insurance. So that does create the need for a sliding scale. There are doulas who provide care for free. There are doulas who provide care just depending on the financial situation of a family, similar to how hospice often does not deny services to someone based on their ability to pay. So that is something that is up to every individual doula, and because it's an emerging field, different people will price their time differently. Some people ask people to pay by the session on a flat rate, or pay for a package of so many times, so many, 1 to 2 hour meetings over the course of a period of time. And some will just go on a visit by visit basis. So one of the other questions that we get a lot is when to contact a doula. And as I described, you can contact someone years before you think you're anywhere close to the dying process. You can contact doulas the day of. It is all about when you're ready. One thing I encourage people to do is when you are at your strongest and most clear-headed, that is when to reach out to a doula and work through some of those hard questions about what you might want at the end of life. I found it a lot easier to say, you know what, I really want to be shrouded and buried, and I want to explore my options for green burial. And I can do that now because I'm not going to look at that ground and have bigger feelings about, imminent presence. And I'm going to feel like I'm taking care of my loved ones and making that decision now, rather than trying to work through it at a difficult time when we have other emotions to work through. And I know people who say, no, I'm never going to think about that until it's a pressing need, because then I'll be able to take action on it and it'll just feel better. Doesn't matter. Whenever you're ready, you can contact a doula. All right, I'm going to stop sharing, and I think we'll just concentrate on answering some questions. So I'm going to take a look at the chat real quick, but if there's anything to highlight, please let me know.
Yes, thank you, Angela. Yes, there was one question in the chat. What is the law in regard to burial on private property that is not in any city limits?
That is going to be a question depending on where you actually reside or where you actually want to have the burial. And that is something that there are a number of resources that I point people to when they are questioning their options around burial. So there is the Green Burial Council, and then the Funeral Consumers Alliance is a fantastic resource. The Funeral Consumers Alliance of Central Texas is probably my favorite go-to resource in regards to figuring out what disposition options are right for someone, or pointing people towards document planning. So I would say that is going to vary greatly. I don't want to give a blanket answer because my knowledge in that area is very, very limited.
Great, thank you. Okay, there was a question that came in. What if your family is uncomfortable with a doula? So what if there are cultural issues?
That is a really interesting question, because I think there's usually people in the family who are hesitant because similar to hospice, I've heard this in regards to hospice as well, bringing in someone like me to talk openly about death is, in the eyes of a lot of people, admitting defeat or inviting death to the door. And the fact of the matter is, death is all around us every day. And it's not this big, evil, scary thing. It causes sadness because it causes loss. But in and of itself, normalizing the conversation can really help. I think that there's not a need for every member of the family to accept someone's choice. But the only time I would say a doula should withdraw services is if the dying individual does not want doula presence. It doesn't matter who hires us. It matters what the dying individual wants. So any other family member, we work with that individual family dynamic, because family dynamics are hard. Culturally, we do the best we can to educate ourselves about the wide range of experiences and needs. And sometimes finding a doula who is from a specific culture or has more knowledge and experience in a specific culture is really helpful to making sure that there's a better chance that they understand what's going on in the greater family dynamics. So interviewing the doulas and seeking out specific doula services may be your best option.
Thank you. I'm going to invite Nancy to come back on camera with us as well. There was a question that was in that you answered, but I'd like to see if you can answer it on camera. So why can't you have any home health to aid with the ADL if you're having hospice at home? Can you please tell us what ADL is, and then just kind of briefly answer the question again, if you don't mind?
Sure. So ADL stands for Activities of Daily Living, and that's often what home health is brought in to do, right? Bathing, eating, dressing, things like that. Medicare considers that a duplication of services. If you are getting home health, which is usually at least partially paid for by Medicare, and then you need hospice care, Medicare isn't going to pay for both. They think our services are enough alike, even though I think we could make the argument that there's room for both. They won't do that. So we cannot be involved if someone actively has home health in their home. They have to choose. So, yeah.
Great. Thank you. There was a question, and I'm not sure which one can answer. How do we share with our patients when they are still fighting, are young, and do not want to hear about hospice or death? So I'll let either one of you address that question.
I can talk a little bit to the death angle. So I find that I get a lot of resistance from my peer group in talking about death and dying because we consider it to be so distant. But the one thing that I can always remind people of that seems to hit home is that, again, this is a gift that we give to our loved ones. And there's no wrong time for this gift. It is the gift of feeling secure no matter what happens, because life is unpredictable. I mean, honestly, driving a car is much less safe than sitting in a hospital room, but we find ourselves thinking more about our mortality in the hospital room than we do in our cars. So it's when starting conversations with young folks, it's about reinforcing the idea that this is not giving up. This is not ending a fight. This is preparing a gift that you will give later when you are not able to consciously and presently give that gift. It will wait for whenever you can really give it meaningfully. So that's a way that I've looked at it for myself.
Yeah, I wanted to hear what Angela had to say, because I always want to hear what Angela has to say. I think, and sometimes what we say when we're working with people is we're not giving up, we're changing strategies, right? We use illness as battle, like we use that metaphor all the time. I don't want to stop fighting. But if what we're fighting is our own body, like we need a better metaphor. We need illness is part of the journey, and so I need to take a detour here. I need to stop and get snacks now, or I need to call a friend. I think we just need a better framework to think about illness so that what we're fighting is not ourselves. And I agree, Angela, you can make plans and then set them aside for 2 years because you don't need those plans, but you're going to be so glad you went ahead and made the plans. I also think, especially with young moms, it's really hard, excruciatingly hard to talk about this. And I think as a mother myself, to think this is one of the last acts I will make as a mother. I am showing my children how to do this. For when, the times when I won't be here to tell them, I'm going to show them. So this is almost like the last great act. I'm going to set the table for you all and show you how it's done, even if I'm really scared and I don't want to do it. That's kind of what we do when we love people. So that's another way to broach the topic, I think.
Great.
Yeah, I would build on that by sharing a story. There was a young mother who knew she was ill, and so she took the time to write birthday cards for her 2 sons for years to come. And even though her illness didn't take her immediately, she had those cards. And once she did pass, her family had those cards every year for years and years down the road. And there were cards for important dates like wedding days and things like that. That is not something you can do at the last minute, but it's something you can do now. And if you're there to give them that card, wonderful. And if you're not, they have it anyway.
That's beautiful. So much. This was such a great program. We are out of time. And so these ladies are happy to have you contact them with any questions you have. Thank you, Angela. Thank you, Nancy. I appreciate you being here with us today. And thank you, everyone, for joining us. Have a good day.
Thank you so much.